Hello.
Hello, come and have a seat. So this is Kevin and Kerry Smith, and you've looked at their presenting complaint and the observations outside. Before you start taking the history, this is Oliver.
Thank
if
you
you
very
just
much.
press play on there, you can see how he is just at the moment.
Is it okay if I watch it again?
Okay, so would you be able to take a history from Oliver's parents about what's been happening?
Yeah, that's fine. Hello, my name's Daniel. I'm one of the foundation doctors. Can I just quickly check your names, if that's okay?
I'm Kerry Smith.
Kevin, sir. And you're Oliver's parents?
Yes.
Okay. I've just had a quick look at Oliver, and I was wondering if I could ask you a few questions about how he's been over the last few days, if that's okay.
Yeah.
So when did all of this start?
I guess for the last 2 days or so, he's not really being himself. He's been very clingy, a bit flushed and tearful. He had a high temperature, so I think it was 38.5, wasn't it? And he's been off his food, and now he's just kind of flopped on the sofa, doesn't really want to do anything.
And his breathing's not really, it's like he's struggling to breathe.
Yeah, his breathing's very difficult.
Yeah, so tell me a bit more about his breathing.
It's just funny, really. I mean, he's sounds a bit rattly. His tummy is sucking in under his ribs, in his neck.
Does he ever change colour at all, or seem to stop breathing?
No, it hasn't stopped breathing. No. He's been a bit flushed.
Just a bit flushed.
Yeah.
Fine. How long? This all started 2 days ago. And has he been in any pain at all?
I wouldn't say pain. The breathing's been difficult for him, which is a bit uncomfortable. But no pain.
So he hasn't been sort of pulling at his ears or seeming like he's got some pain in his throat?
No.
Okay. You mentioned he was eating and drinking less. How much has he been eating and drinking over the last couple of days?
Gradually he's been having less and less food. I mean, he didn't have breakfast this morning, but he has been drinking water and juice.
Okay, so he's still been going to the toilet, weeing.
Yeah.
And any change in his bowels at all?
No, I don't think so.
No, so no diarrhea or anything like that. Has he had a cough alongside this?
Yes, he has. He has had a cough.
Yeah.
Has he been bringing anything up with it, or?
It sounds like there's something there, but it is not really. Nothing's coming out.
Yeah.
It sounds a bit rattly. Yeah.
Just coughing really fast.
Yeah.
Okay. And have you noticed any other changes alongside this?
Other than just he's not interested in anything. He doesn't really want to talk, or he just wants to sit on the sofa. Yeah.
Any change in his voice at all?
Not really. No.
Okay.
He's not talking much, but
Yeah. And have you noticed any other changes with him?
I don't think so.
No. So no rashes.
No.
He's never had any funny turns or made any funny movements or anything like that. Okay, so just for the last couple of days, the main problem's been with his breathing. It's been getting gradually worse. Since then, he's now a bit more listless. He's not really doing much. He's off his food. He's had a bit of a cough, and he's just generally uncomfortable with a fever.
Yeah.
Okay, good. Do you mind if I ask some more general questions about how Oliver is?
That's fine.
So going back to when you were pregnant with him, how was the pregnancy?
Fine, normal, no problems.
No problems at all. And when you gave birth to him, was that a normal vaginal delivery?
Yeah, normal vaginal delivery, full
Fine,
term.
full term, was it? Excellent. And afterwards, did you have to stay in hospital for any period of time?
No.
No? Okay, good. And then after leaving hospital, has he ever had to go back in for anything?
No. It's usually very fit and well.
Nothing you see your GP for?
No.
Okay, so no operations, and he's otherwise well in himself. Fine, good. Did he take any medications at all?
No, doesn't know.
Fine. And allergic to anything?
No.
Fine. And have you tried any Calpol or anything like that?
No.
Okay, so he hasn't had anything yet.
No, just some echinacea and tea.
Just some teas and things. Okay, good. And also just in terms of his development, does he go to nursery or anything like that?
Yes, he does. He goes in the morning.
Have you got any concerns about his development at all?
No, they're very happy with him, so are we. Yeah.
Okay, good. And in terms of nursery and at home, has anyone else been unwell at all?
No, not that I'm aware of. There's always something going around at nursery, but nothing dramatic that we
in
know
particular. Good. And who is at home with him?
The two of us and we have another son.
Okay, so what's their name?
Ginny, 7.
Jimmy. And who's at home with them at the moment?
He's with my sister.
He's with your sister. Fine, good. Have you got any conditions that run in the family at all?
No, not right now.
No, sounds normally well. Fine, good. And the question we ask everybody who comes in, does anyone in the household smoke at all?
No.
Fine, okie dokie. So he's normally fit and well, doesn't take any medications. Has he had his vaccines?
He had his vaccines at 8 weeks, but nothing since.
Nothing since. Any particular reason for that?
Or we just decided to go down a more natural route.
Okay, so you sort of you decided against it sort of because you're worried about it?
Yes, we've had some horror stories,
Okay.
and we just decided not to.
Okay, so he's had one set of vaccines, he's had none since. His birth history and things was normal. He's normally fit and well. He's got a brother at home, no conditions in the family. Good. Okay, so I'm just going to have another look at him if that's okay. And then I think we'll try and decide again on some treatment. Did you have any other questions you wanted to ask me at this point?
No, not at the moment.
Okay, perfect.
Thank you.
Could I just have another look at the video? Okie dokie. That's fine.
Is there anything else you wanted to ask at all?
No, I think that's probably it.
Okay. In which case, can you tell me what you think are the 3 most important things from your assessment of Oliver, and tell me why you think they're important?
Okie dokie. So starting off the examination findings, Oliver looks listless, he's not really interacting, he looks quite floppy. Looking at the pattern of his breathing, he's got a lot of accessory muscle use, he's got inspiratory noises and expiratory wheeze. Inspiratory and expiratory wheeze. He's got what looks like possibly paradoxical respiration as well, so he looks like a very unwell child. So from the examination findings, that'd be the most important thing. And then from the history, the fact that he's been febrile, that he's been getting worse for the last couple of days, and the fact that the third thing would be that he's not had his vaccine, so he's potentially got an atypical organism, or an organism which we don't see very often anymore.
Okay, thank you. So on the basis of that, what is your most likely diagnosis, and are there any differential diagnoses?
Based on the examination findings, because he's got an inspiratory wheeze, so a stridor, I'd be worried about epiglottitis, especially since he's got a history of missing some of his vaccines as well, and he looks very unwell and he looks quite toxic in a way. In terms of my differentials, so a chest infection causing sepsis, so a pneumonia would also be up there as well.
Okay, thank you. And as a foundation trainee, what would you do next?
You've had 8 minutes.
Okay. So the first things I'd do would be to do an AT assessment of Oliver and try and stabilise him as best I can. That would probably involve giving him oxygen. I may want to waft this, I don't want to distress him at all. I wouldn't examine the mouth or anything like that. In terms of further actions you probably want to take bloods, get a cannula in. You want to give some red flag sepsis antibiotics probably and get him started on those. Arrange some investigations maybe, like a chest x-ray. They've said that he maybe wasn't drinking as much as normal a little bit, so maybe a fluid bolus would be good as well, or a fluid challenge if we can. But prior to this, I'd immediately get senior help, because I think this is quite an unwell child and I want some help early on.
Okay, thank you.
You've had 10 minutes.
Okay. The paediatric registrar has reviewed Oliver's chest x-ray and has said that he has a community-acquired pneumonia. He plans to admit Oliver to a paediatric ward and start on amoxicillin because he's still able to actually eat and drink at the moment. The registrar has asked you to prescribe Oliver medication for his fever and headache, and then have a discussion with Kevin and Kerry about the current management plan and vaccinations. So if you start with the prescription, and I'll remind you what to do when you've finished.
Thank you very much. Okay. So I've written up some paracetamol there for his fever and to make him more comfortable.
Okay, thank you very much. And now if you could have a discussion with Kevin and Kerry, both to explain the current management plan and also to explore the idea of vaccinations. Thank you.
Hello again, Mr. and Mrs. Smith. I saw you earlier today in the emergency department while we saw Oliver because he was looking a little bit unwell. I was just wondering, has anyone given you an update since then about what's been going on?
No.
Okay, so what do you understand has happened so far?
Well, I think, did the registrar say that he's been admitted?
Mm.
Or he wants to admit him?
Yeah.
Yeah.
So what that means is that we take him from the emergency department and take him to a ward where it's a bit quieter, maybe more comfortable, and we can give him the treatments he needs. In between sort of when I've seen you, he's had an x-ray of his chest, so a photograph of his chest. Has anyone spoken to you about the results of that at all?
No.
Okay, so what that shows is that he's got something we'd call a pneumonia. Do you understand anything about that at all?
I've heard of it, but
Yeah.
I've never had it.
Okay, so all it is that it's a chest infection which causes an accumulation of sort of snot and other gross stuff sort of in the chest, along with some bacteria or viruses. And when we take a picture of that using an X-ray, we can see that on the X-ray. We can see that accumulation of stuff, which we call consolidation. So that's what pneumonia is. It's a chest infection where we can see this consolidation on the chest. Does that make sense?
Yeah.
Okay. So often that's caused by a bacteria. So the treatment that we're giving Oliver is an antibiotic because that's how we would get rid of bacteria.
Is that completely necessary? I mean, could we not take him home and treat him ourselves with our own medicines?
So I think any parent would rather have their child at home, and we'd rather Oliver was at home and comfortable and well. But at the moment he's just too unwell to be able to go home, and that's why he needs to be admitted and taken to a ward so that we can look after him and make sure he gets sort of the help that he needs really. In terms of the treatments that we'd give him, we would have to give him an antibiotic because the only way to get rid of the bacteria which have grown in the chest is to give a medicine, so an antibiotic, which gets rid of them.
You've had 15 minutes.
Yeah, I think we have to.
Yeah. Okay.
Okay.
And you'll be able to stay with him on the ward all the time if you want. You can just focus on getting him back and better to how he was before. So we're giving him the antibiotic, and then we're also giving him some Calpol, some paracetamol to keep his fever down and keep him comfortable. Does that kind of all make sense?
Yeah.
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 Okay. Yeah.
Okay, good. The other thing I wanted to speak to you about, now that Oliver's a little bit better and we've got a chance to have a chat, is about his vaccines. I know that you said earlier that you'd sort of not wanted to give him any and he'd only had the one set. So I was just wondering if you could tell me a little bit more about your reasons for not wanting him to have vaccines.
Well, we've just heard a lot of horror stories. I've seen some horrible videos, and there's a lot of talk about them getting ill afterwards, and I know that there's a link to autism, and I just we just preferred to not give them.
Yeah, and it's something that people tell me fairly often when they bring their children in and they haven't vaccinated them for those reasons. There are a lot of scare stories out there on Facebook, on various social media sites, and you sort of talk to your friends and they speak about it as well. But actually vaccines are really, really safe. You talk about a link to autism. That was based on a study a long time ago, and since then categorically proven that there is no link between autism and vaccines. So that's not really something that we worry about anymore. In terms of the risks that we sort of said that children have been unwell afterwards having had their vaccines, occasionally children do have quite mild reactions to vaccines, maybe a little bit of itching, a little bit of swelling where the injection site is. Sometimes they can be a little bit unwell, kind of like just before you get a cold, sort of that feeling of, oh, I don't feel quite right. Sometimes they can be a little bit like that for a day or so afterwards, but it's nothing permanent. And the reason that I would definitely advise that you do have the vaccines is firstly, because there's a lot of very nasty diseases which we don't see anymore, things like measles, mumps, rubella, all of these diseases which we don't see anymore because of vaccines. And the reason that we created these vaccines is because these diseases are very nasty. They potentially can kill children, they can even disabled, they can be really debilitating. And not just for the individual child, but some children, particularly children with cancer who are on certain therapies, aren't able to have their vaccines. And what they rely on is that everybody around them has had vaccines so that they don't get these conditions. So potentially Oliver could carry something like measles, not get the infection, but then pass it on to another child and make them unwell. So for all of those reasons, I would strongly recommend that you reconsider giving Oliver his vaccines. How do you feel about that?
I mean, it's not something. I mean, we did make the decision not to, and I appreciate what you're saying. It's just hard to ignore all the horror stories in the chats online. But it does make sense what you say.
Yeah, I guess you're saying it's good for the child and also good for other children.
Yeah.
You've got 2 minutes
It's
left.
hard to argue that.
Yeah, and I can certainly see where you're coming from. There's lots of people do come in, and there is a lot of misinformation out there. So maybe what I can do is that we don't need to give these vaccines right now, because we wouldn't usually give them while Oliver's unwell anyway. So we've got time to think about it. And perhaps I could get you a leaflet and some further information about vaccines.
Yeah.
And then you've got time to digest it, read about it, and then maybe we can have another discussion about it later down the line once Oliver's a little bit better.
Yeah, that's fair. Yeah.
Does that sound like the better plan?
Yeah.
Okay, have you got any questions right now?
I don't think so.
Okay, about this or how Oliver is or anything at all?
No, just we just want him to get better as soon as possible. So
Yeah, I think we'll all work as a team, yourselves, the nurses, and the other doctor on the ward, and everyone else will help to get Oliver better, and hopefully we'll turn a corner soon. So, good.
thank you.